Hi, in this video, I'm going to be talking about clinical trials and in particular, why it's important to have a wide diversity of people who participate in clinical trials. Why would you participate in a clinical trial? Why would you go through the extra tests and the extra aggravation? Well, clinical trials are a chance to get something better than the treatment we already have. So we've got great treatments and we want to make them better. Most clinical trials that are looking at particular anti-cancer treatments, whether it's chemotherapy or endocrine treatment, compare a new treatment to the standard. So there's no placebo controlled. You're going to get treated. If you don't go on the clinical trial, you'll get the standard. If you go on the clinical trial, there's a chance you'll get the newer treatment. It's important to know that all clinical trials are reviewed rigorously by scientists, by ethicists, and by the doctors who actually treat patients. And if somebody offers you a clinical trial, it's because they think this gives you a chance to get something better that might be better than the best we already have. I hope that makes sense. Of course, you're monitored very closely. You can come off the trial at any time. You come first, not the trial. So you can consent to the trial, sign the form, have the big discussion, start treatment, and then change your mind. You might also find your doctor say this trial isn't right for you anymore because you're having these side effects. The other thing to know is that if new information comes out saying that the clinical trial should be stopped because another study showed that a particular treatment on the trial is superior, the trial will be stopped. So we always put the patient's interest first when we put people on clinical trials. You're not a guinea pig. You're not getting a placebo. We do sometimes use placebo-controlled trials for symptom management. So let's say we want to look at a drug to see if it helps with fatigue. Well, placebos help with fatigue, so we want to make sure that this new treatment we're studying is better than the placebo. And you will actually get some benefit from the placebo if you're randomized to that group. In other words, if the flip of the coin or the die says you're going to get the placebo and you won't know it, you'll still benefit. It's pretty amazing. The other reason clinical trials of all sorts are helpful is because you're monitored really closely on that clinical trial. You have a whole set of people who are available to you in addition to your medical team. Now, you may not want to be available to have more people available to you, but a lot of people go on clinical trials because they like that extra support. And finally, you get informed the results of the trial, which is pretty interesting. So lots of reasons to participate. One reason that a lot of people participate in trials is because the way we got to where we are now is through clinical trials, and they want to pay it forward. They want to help out their biological or metaphorical daughters. So the reason we know how to treat you now is because thousands and thousands of women have gone on clinical trials, and we're deeply appreciative of that. Okay, so let's talk about diversity in clinical trials. It's really hard to find clinical trials that have the same representation as our population. So you'll see people who are native populations, indigenous people, people who are Black. You'll see fewer people who are older, and you'll see fewer people who struggle with finances, who live in rural areas, who have other challenges. Clinical trials will often pay for the cost of transportation, and they will pay for anything that's not part of the treatment off trial. So, for example, if you need extra blood work or extra scans, the trials have to pay for those. But trials can also reimburse you for transportation. One of the things that we've noticed in clinical trials is that they tend to have a higher number of people who are well off and who are white. And so we have fewer people who, I'll give a particular example in breast cancer, poorer representation of Black women. And Black women's breast cancer tends to present earlier in life and to be more likely to be triple negative. There's no biologic difference between Black people and white people. Race is not a biologic construct. It's not related to your biology. Different treatments don't work better in some people than others based on the color of their skin. However, the disease itself can be different. We don't always know why this is. It's not necessarily your ancestry, though some genes may be linked to your ancestry, but we know the disease shows up differently. And wouldn't it be great to know that this treatment that works really well in white people works just as well in Black people? So we don't want to say you should enroll in this trial so we can learn more about the trial and about this treatment in Black people. But we can't advance the field without the participation of a diverse range of people. As much as it's poor representation of Black people, Native populations are particularly poorly represented. And it would be so important for us to be able to say this treatment is as effective in Native populations. Now, Native populations, of course, are extremely diverse, with over 500 federally recognized tribes in the United States. So I want to be really careful not to say all Native people are the same or all Black people are the same, just like we don't say all white people are the same. But increasing participation of underrepresented groups is really important so that advances in breast cancer can be shared equally. That's a principle of justice. At the ethics of clinical trials, we have do no harm, we have make sure people are informed, and we have make sure there's justice, so that if you see trials that have very few people that are benefiting from and bearing sort of the burdens of the trial, you want to make sure that's equally distributed, and we try to offset those burdens. I've covered a lot here: why to participate in clinical trials, how you'll be followed when you're on clinical trials, how we put you first, and why it's important to have diverse representation. If this has been interesting to you, click like and subscribe, and you can always drop a message in the chat and we'll get back to you within a week or two.